Knock, knock. Hi, guys. So May is Skin Cancer Awareness Month. And as the sun is finally coming out here in Boston, it's important to review 5 important things to know about skin cancer. If you're just tuning in, I'm Dr. Abby Waldman. I'm a dermatologist at Brigham and Women's Hospital in Boston, Massachusetts. So the first is skin cancer is extremely common. Skin cancer can include melanoma, but it can also include non-melanoma skin cancers like basal cell carcinoma and squamous cell carcinoma. These together comprise essentially one of the most common types of cancer, with more than 5 million people diagnosed each year in the United States alone. Many famous people have had skin cancer, including Hugh Jackman, Diane Keaton, Khloe Kardashian, Bob Marley, just to name a few. And most of us will know somebody who has had skin cancer. The good news is that the vast majority of these skin cancers do not spread inside the body or metastasize into the lymph nodes. The majority of skin cancers can be treated surgically, with some caught very, very early can even be treated with a cream or a destructive procedure. In rare instances, other therapies such as radiation, immunotherapy, or chemotherapy may be indicated. While anyone can get skin cancer, you're at higher risk if you have fair skin, light eyes like blue or green, if you have a family history of skin cancer, or if you personally have had lots of blistering sunburns or excessive sun exposure in the past. And you may say, I never go out in the sun, I'm always covered, but even sunburns that you got way back in your teens or 20s can come back to haunt you later on, decades later. Also, those of you who have immunosuppression, usually due to some sort of organ transplant or on an immunosuppressive medication, are at increased risk for developing skin cancer. As we all age, our immune system weakens and becomes senescent. It just doesn't spend as much time searching around trying to fight those skin cancer cells, and so more things get through. And so that's the reason as we age, you're more likely to get skin cancer. The warning signs of skin cancer include changing in a mole, if it was once round and now it's shaped like Florida, if it was light and then dark, or dark and then light, if a lesion is bleeding or itching, or if a new lesion appears and it doesn't go away in about 6 to 8 weeks, that should be brought to the attention of your dermatologist. Your doctor or dermatologist may decide to take a little sample of the mole or the lesion and send it to the pathologist for diagnosis. The vast majority of skin cancers are due to sun exposure, particularly history of blistering sunburns. Of course, there is a family or genetic component to your risk of developing skin cancer. The best way to prevent skin cancer is to protect yourself from the UV rays from the sun. This can be done by wearing protective clothing, particularly long sleeves if you're going to be out in the direct sunlight, wearing a hat, the broader rim the better, and applying sunscreen of at least 30 SPF broad spectrum every 2 hours to any sun-exposed skin. It is also important to avoid tanning beds and other sources of UV light, which can increase your risk of skin cancer. You can check your own skin regularly for any new or changing lesions. Taking photos can actually help monitor lesions and also provide some evidence to show to your dermatologist if you do need the lesion to be assessed. If you have a family history of skin cancer or if you have a significant sun exposure history, it's good to get at least a baseline check from a dermatologist head to toe, and then they'll recommend regular screenings thereafter based on your personal history. If you have a personal history of skin cancer, then it's important to get checked at least once a year, head to toe by a dermatologist. And depending on what your prior diagnosis was, how long ago it was, what your treatment included, you may require 2 and often many more visits per year in order to monitor your condition. I know our dermatology department at Brigham and Women's Hospital does free skin screenings during the month of May, and you may look in your area to see if there are others that are providing free skin screenings during Skin Cancer Awareness Month. So tell me about your experience with skin cancer. Leave your comments, like this video, and please subscribe to get more videos like this. I'm Dr. Abby Waldman. Be well.